The COVID-19 pandemic has led to millions of deaths and tested the capabilities of the public health system and the medical system worldwide. It has been estimated that the COVID-19 pandemic caused the global gross domestic GDP to decrease 4.3% in the year 2020. There had been millions of deaths all over the world, and the government measures to reduce the virus spread caused a domestic and international market disruption, which had caused a decline in different countries' GDP. Vaccination is without a doubt one of the most outstanding health inventions, which has saved millions of lives every year. It has also spared children and adults from painful diseases and absence from education as well as work. It is also considered as one of the success stories of health systems in the World Health Organization (WHO). However, still, some of the individuals and population groups remain unvaccinated or not fully vaccinated. During the pandemic, the demand for COVID-19 vaccine increased over time. While the COVID-19 vaccine was created and approved a lot quicker than all the other average vaccines, all the necessary safety and testing precautions were not sacrificed to achieve the results. In this presentation, I would analyze the demand for COVID-19 booster vaccine in Ohio based on the news article named "Health Officials Expect More Demand for COVID-19 Vaccine Booster." This was written by Ellen Olson on May 23, 2022 and was posted on the Intelligencer Wheeling News Register. To analyze this article, I have divided the sections into two different parts. First off, I would start off with the introduction of demand, where I would discuss what demand is. I would highlight the factors that have increased the demand for booster vaccine, and then I will finish off with explaining how there might be a decrease in demand for the vaccine in the future and conclude with Islamic perspective. Economists define demand as the amount of some good or service a consumer is willing as well as able to purchase at each price. Market demand curve illustrates the relationship between the total quantity and price per unit of a good all consumers are willing and able to purchase, holding other variables constant. Law of demand states the quantity of a good consumer is willing and able to purchase increases as the price falls. On the other hand, the quantity of a good consumer is willing and able to purchase decreases as the price increases. The statement can be proved from the graph below. Demand curve. The demand curve is a graphical representation of the relationship between a price of a good or service and the quantity demanded for a given period of time. These are the highlights of the article. COVID-19 booster shots for children ages 5 to 11 are on the way. Vaccine will be soon available for children under 5. Authorization in children would expand the vaccine-eligible population by millions of people. Parents are concerned with their children getting vaccinated who are younger than age 5. It will be a bit challenging to convince them to get vaccinated. Increasing subvariants of Omicron. Factors that have caused the demand for booster to increase. There are 3 COVID vaccines approved for use in the US and most of the countries worldwide, which include the Pfizer, Moderna, and Johnson & Johnson, which are all highly effective in protecting us from COVID-19. The CDC, however, prefers the mRNA vaccines. These are Pfizer and Moderna. I would like to highlight reasons why the demand for booster has increased over time. Increasing demand from governments battling to halt the pandemic or intensity of consumer needs. In my opinion, economy has been affected a lot by this pandemic. With FDA approval, Pfizer COVID-19 booster should be considered a safe vaccine. It is also approved by WHO. I believe this would also increase the demand for Pfizer booster vaccine from different governments of different countries all around the world. Increasing eligible population or authorization in children as mentioned by the article. The governments are making it a necessity to get vaccinated and booster shot. This means it would increase the demand for vaccine. It is mentioned in the article that Pfizer is increasing the vaccination eligibility population. More children are authorized for Pfizer vaccine and booster shots. This will also increase the demand for Pfizer booster vaccine. Increasing subvariants of Omicron and travel restrictions. As mentioned earlier, there are travel restrictions. In some countries, travelers are not allowed to enter without being fully vaccinated with booster. For instance, in Malaysia, it is a must to be fully vaccinated with booster. If not, you will have to be in quarantine. Not only that, I think increasing in subvariants of Omicron has also encouraged people with 2 doses of vaccine to get their booster. Changes in demand curve due to increase in demand. D1 will be considered the initial demand curve for the booster vaccine. With the increase in demand, there will be a shift in the demand curve to the right from D1 to D2. The points that I mentioned earlier, which include intensity of consumer needs, consumer preferences, population in need of vaccine, are all factors that would cause the demand curve to shift from D1 to D2. Decrease in demand in the future and how it would affect the demand curve. Demand for COVID-19 vaccine is dropping worldwide, even in Africa, where vaccination rates are lowest. This was stated in an article news reported by Frazier Kansteiner. I believe one of the main reasons for it is hesitancy. It was also mentioned in the article that I am currently analyzing that parents are hesitant to get their kids vaccinated. This may be because of the uncertainty that the vaccine works or what effects it could have on their child's body. Not only that, in my opinion, the demand will reach a demand turning point in the future. This is the moment when the industrial trends are reversed. One of the largest vaccine sites in Alabama, a drive-up clinic at Hoover Metropolitan Stadium, operated by the University of Alabama, Birmingham, closed this year on May 18th. Not only that, many people are fully vaccinated with boosters and the infection rate is also getting low. The fear that people had for the COVID-19 is also decreasing. COVID-19 is turning out to be a normal flu. This would cause the demand of the vaccine, including booster, to decrease. This will cause the demand curve to shift to the left from D1 to D2. Demand and supply are two words that are often used by economists all around the world. These are the basic concepts in a very broad economic activity, and both are the forces that make the market economy work. The concept of Islamic economics regarding demand and supply is almost the same as conventional economics, but it is important to keep in mind that there are restrictions from individuals to behave economically in accordance with Sharia. In Islamic economics, Islamic norms and morals are the principles that underline the economic activity. The study of Islamic economic and social problems is in reference to the Quran and Sunnah, which is independent of those Greek social and economic thoughts. Rahmatan lil Alamin will only be realized only if Muslims have a correct understanding of the teaching of the Quran and Hadith. While most cartel and large organizations are doing everything in their power to take advantage of the situation, for instance, increasing the price of masks and sanitizer in this pandemic, but in Islam, they will encourage us to sell these at the lowest price as possible. This is the concept of Rahmatul lil Alamin, which is a blessing and kindness to all mankind. Not only that, I think and I believe that vaccines are a blessing to us all. So it should be priced and distributed properly. Thank you.